My name is Nafisa Gregory. I currently have my Bachelor's of Science in Allied Health Sciences, and I am currently pursuing my fast track master's in public health. I pursued my MPH. So I'm a first gen Guyanese student. So I'm from an immigrant background, so I didn't really know what public health was. So when I came here, I went to high school and I got exposed through an initiative funded by the city of Hartford, called Hartford Teen Pregnancy Prevention Initiative. And so we went around to public high schools and basically educated them about safe sex, STIs, and teen pregnancy prevention. And that was my stepping stone towards getting into public health. So I got involved in this grant via email. I applied, but it was so bizarre because I didn't really understand what it was about. But I wanted to take part in that opportunity towards building my skills and knowledge. And being placed at the health center has helped me a lot throughout that process. So I just wanted to build on my skills and get a little more experience of what exactly different career paths are in public health. So my health department was the New Britain Public Health Department, and it was basically environmental health. So for my role with them, I was expected to mostly do behind the scenes stuff. So a lot of times, public would apply for like licenses and permit for food establishments or restaurants. So when they apply on our public portal, on the back end, that would come into us. So I worked on basically the software behind that and how to go about navigating that. There was a lot of issues with it, like with the workflow wise. So I figured out how to basically make that a little bit easier for staff. So when it comes into them, it's easier to issue an invoice and issue that permit. There was a lot of glitches within the system. So majority of my thing was just working on behind the scenes and how I can make that workflow better. Some major challenges was just getting to know the software. Like I didn't really understand the software at all because it's fully new to me and I am tech savvy, but I'm not really into the software aspects. So that was a big challenge for me, as well as learning codes, not just the codes that the city uses for ordinances for like restaurants that they have to upkeep, but as well as EPA or FDA approved codes that restaurants and stuff like that need to follow in order for sanitarians to issue that permit. So the funding from this grant really has helped me a lot, not just financially, but it allowed me to not stress about the finances and focus more on where I want to go and what path I want to take within public health. So I think this grant has really helped me towards honing in on future career path, being that now I know that I want to be a sanitarian in the health department. I want to establish on that a little bit, but I also would like to be a nurse in public health.